So today's struggle with a lot of orthodontists, every orthodontist really, is patients wanting to seek treatment to do it themselves versus coming to us.
Right.
As far as clear aligners go.
How has that impacted your professional life and your practice? Has it impacted you?
I don't feel like it's affected me negatively.
Right.
I don't have any fewer patients coming in the door.
Yeah.
You know, it hasn't decreased, you know, the calls coming in. Like I said, I have a few patients that finish there and
then
like,
end up there.
Right,
Okay,
well, I need you to really finish, you know?
Right,
So
no,
please.
I get it. Yeah. What was the thing that made them come to your office then? At what point?
I think there comes a point where they're like, this is just isn't right. Something that doesn't look right.
Teeth aren't touching, not so well.
Or I'm done. I have no more in this little box of mine, and this just isn't. Nothing's fitting together right, and it doesn't look like how I wanted it to look. I think I need to have a doctor look at this now. And
I think the vast majority of individuals, really, when it gets right down to it, they know. I think they know that who's holding the ball here, because if you're the patient thinking that, to me, that's very unsettling. Like, am I done? I mean, I'm not, what's the end point, you know?
If the patients want an experience, and I think what I'm hoping is, what they keep saying to me, what I keep hearing is, okay, millennials love experiences and love, this and that. And so in order to have that experience, throughout treatment would be in an office setting.
Right.
And if they don't really have that structure, if they don't really have someone to hold them accountable, to wear their aligners to get to the end result that they want, then I think that maybe they'll start to realize.
Disappointed, or they'll start to realize.
Be disappointed and realize, okay.
People want to be taken care of in a professional way, but they want that experience. I mean, so the key then is just to get them across your threshold, right? They just need to get in the office, because we're used to dealing with second, third, fourth opinions, right? And actually, we don't mind them. I mean, actually, they're kind of fun, because you see it as a different challenge and you want to win, and so you want to outdazzle or whatever you do, right? And so this one's a little different though, because there's not a person you can point at and say that don't go to him or her or whatever. It's this concept of essentially medical treatment unsupervised, at least as far as how we are used to considering supervised medical treatment.
Right. It's overall having the big giant there, or several giants around, has made just more awareness to the public about the opportunity, the ability to straighten teeth, and it's given them another avenue to do that. And maybe those people wouldn't have come to our office ever anyway. Right. So it may not be so much skin off our back as we think
maybe it wasn't a
thought.
Fit in the first place.
Correct. But it's just created a more of awareness.
I think that the only thing that's helped me personally is not having a fear-based reaction. I try to look at it abundantly and think, listen, there are more teeth out there than any orthodontist could ever possibly treat. There just are. I got to think those people have friends, they have family, they have whatever, and so it is just it's a force multiplier. And if you look at it like that, then I think that it's a great way to think.